people of Delhi who have been severely affected by the increasing amount of air pollutions and also by the ramifications of the AQI surging to almost in the very poor category, there is a relief, although not as much as important of the pollution level decreasing, but there is in fact a good news for the people of Delhi who are now facing such serious health problems, including the severe respiratory illnesses, to get treatment and to find a place where their illnesses can be identified. I am talking about a pollution clinic that has been set up in the Ram Manohar Lohia Hospital in the national capital. And to talk about this is joining me Dr. Pulin Gupta from RML, who is going to talk to me about what exactly is this new facility and how, in fact, this is going to be more advantageous. Thank you for speaking to us. Sir, what is in fact this entire setup that is not now being brought up, and how this is going to be advantageous and useful for especially for these people who are now affected by the respiratory illnesses?
Thank you very much. See, this is a very novice idea in the sense that we have been listening about that these are all pollution-related disease. People are coughing, people are having problems. So what we thought of that, let's have a clinic where not only there are doctors from pulmonary medicine, the respiratory medicine, we are keeping doctors from ophthalmology department because pollution is again a problem for eye disease also. We are keeping doctors from dermatology. That is again because pollution is associated with eczema, dermatitis. And on top of that, all these patients who are suffering with chronic cough, chronic disease do develop some type of anxiety and depression. So a psychiatrist is also going to sit at that place. And with increasing number of times, maybe we will add a ENT surgeon also and person from general medicine also. So effectively, there are 4 different doctors from 4 different departments apart from the residents. And since we know that pollution is not only the thing which is associated with respiratory disease, it's a disease which is associated with increased cardiovascular disease also, stroke also, hypertension. So that is why the idea is that let us provide a comprehensive care at one step to all those patients, because we do not want patient to move from one place to another, one place to another. So this is actually the thought, the idea we started this.
As I can understand, this is a one-step solution when there is an issue in the metro city like pollution happens. This is a one-step solution medically which can help the patient get the treatment which they deserve. But is it the first time that there is this pollution clinic that has been set up specially to dedicate to these issues?
Yes, this is the first time, probably as far as I know, at least in NCR, this is the only and the first clinic which has been set up, and this is specifically keeping this point in mind that these are the patients who sometimes go to a department of medicine, sometimes go to a ENT surgeon, because most of these patients have cough, coryza, sputum production. So these patients have to run from one department to another. Apart from that, these are non-communicable disease. 99% of the population on this earth is exposed to pollution-related disease. We actually are not keeping these things in our mind, and almost 80 lakh people throughout the world die because of pollution-related disease. So it is a step ahead to look about the future, because this pollution may increase, and we know it is bound to increase. With this increasing urbanization, transportation, it may develop. So let us start a process where we can pick up on those patients who need utmost care. For example, all diabetics, all patients who are asthmatics, COPD patients who are taking some steroids, diabetics. So these are our priority, that let's see these patients if they need immunization, vaccination. And the problem is that most of these patients who have cough may go to a doctor, or sometimes most of these people start taking antibiotic by themselves. So rather than exposing them to over antibiotic use, we are seeing this patient whether they need an anti-allergic, whether they need a mucolytic, whether they need an inhalational therapy. So that is actually the idea. And yes, most of these patients who are coming to this clinic are actually the patients who are having respiratory problems more. But we are encountering people with dermatitis, skin problem, because the two-wheeler drivers are being exposed to this all this dust and this pollution. So yes, we are telling all these people that you should use a full cover, like full sleeves shirt, full sleeves trousers. That will not only help you protect from pollution related disease, it will help you protect from the viral disease also, like dengue and malaria. It is happening right now. So this is, and then again, these are the same people who are exposed to dust causing dryness and some problems of eyes also. So this is actually a center where we are providing more of counseling, prevention, and yes, whoever needs care, we are always there to help them. It is our duty.
As we can understand, this is indeed going to be a place where mostly all the pollution related ailments will be having a solution, and this will also prevent patients to get this problem more deteriorated. What are the days when people can come, and what are the timings in fact for the benefit of the viewers, where we can understand that they can get the consultation?
Yeah. As a faculty of this hospital, let me tell you one thing. Any patient who is having problem, severe problem, can come to our emergency anytime. We are always there to help them. But as far as the people with pollution related disease, this clinic is going to operate on Monday afternoon 2 to 4 p.m. The registration will start at 1:30 p.m. room number 125 general OPD. Right now we are keeping one day, a selected day. If the number of patients increase, it will be increased to 2 days and maybe 3 days. So it's a specialized clinic. So initially we have started as a one-day clinic, but we may increase the number depending upon the number of patients coming to us.
And what is the capacity?
Right now, in a span of 1 month, the number of patients coming to our this clinic is almost 10 to 15. But again, you see, this people are actually not aware of this thing. People do not know that this type of clinic is going on in a hospital. So with improving knowledge, with dissemination of this knowledge, I believe that in a span of next 1 to 2 months, we will reach the break even what we actually keep as 40 patients, which actually we see in 2 hours, 40 to 50, at least in a span of 2 months.
Okay. Is there also the need at this point of time for more such hospitals and more such government related medical institutions to come up and cater to this, especially in the metro cities?
Obviously, I see most of these patients have been coming to medicine OPDs and ENT OPDs, and presentation is always like bronchitis, cough, sometimes fever also. So we have been treating these patients, and yes, you are absolutely right that in fact all the government hospitals of Delhi are actually catering these type of patients. Now with this new invention from our side, probably new setups will come into picture in Delhi, and not only the people of Delhi, the people of NCR, people from Ghaziabad, Haryana, they will also get benefited with this clinic.
All right. Thank you for speaking to NewsX. In fact, this is the bone of the contention, that in such times when the Delhi has become a gas chamber, this is the need of the hour. When we are talking about the mitigation efforts and for the governments to wake up, this is in fact one such place where the people who have been severely impacted and also struggling to find the right treatment, now we are getting such places, and in fact the centers which are operating on the basis to give the resolution at the right time with the right kind of remedy. This is Simran with video journalist Sudhir for NewsX.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.